Hi there. This is Dr. Stephen Bills with TeleMeMD, and I'm here with a good friend of mine. This is Dwight Smith.
Hi.
Dwight, good to see you.
Good to see you, Dr. Bills.
Thanks for taking some time to answer some questions and to give us a chance to find out a little more about who you are and what you do and how you can help other people.
Absolutely.
If
Thank
that's
you.
all right with you folks.
Yeah,
So,
thanks for giving me the opportunity.
absolutely. Well, why don't you tell us a little bit about yourself and
Sure.
your background, and we'll kind
Sure.
of go from there.
Okay, sounds good. So, as Dr. Bill says, Dwight Smith with Amada Senior Care. Background is I'm from the Toledo area. Was born at Toledo Hospital, raised in between Toledo and Swanton. Graduated, went to a university a little bit further away, and then came back and worked for a local company. And then through a couple transitions in my life, ended up back, went away for a while, came back, and linked up with a medical device company. Worked for that company for 15 years or more. And then in 2009, there's some situations that went on with my dad and his cognitive ability that preemptively worked into where I am now and how I made this transition in 2020. So
That's awesome.
yeah.
How did that relationship and how did that episode with your dad kind of, what was it about that experience that led to a pivotal change in your life?
Sure. So what kind of happened was I saw care for him and the good care that that I observed. I really wanted to be able to provide that to others. And so there was some care that I saw that was really good, and then there was some care that I saw that could use some improvement. And I felt like if I could emulate the good care and provide that to others, then that would make the community a better place.
That's great. I think
Mm-hmm.
we have parallel stories.
Mm-hmm.
When my parents were going through some problems themselves, and I had some folks come into the home. There were some good experiences, some bad experiences,
Mm-hmm.
and it taught me a lot about what is needed in the home.
Mm-hmm.
So, in that line of thinking, what are the types of services that you offer
Mm-hmm.
with your business?
Sure. So we offer non-medical assistance with daily ADLs, toileting, dressing, bathing, shopping, running errands, helping with mobility, medication reminders, respite for the caretakers, so we can come in and spend time with the person at home to allow for the people that are the loved ones to be the loved ones and not to feel, to get that break, which is much needed. We do offer some assistance with senior housing guidance. We have a what we call it. It's a Amada Connect, and it's a system of emergency response systems, medication dispensers, and then we are trying to work towards this program, which is called the DART program, and it's basically discharge emissions reduction
Hmm.
team. And by doing that, our goal is to set up these care plans to allow for people that are discharged to get to a healthier status and
Right.
recover quicker, so that their odds and chances of going back in are
Well, that's
low.
huge.
Yeah.
Insurances are big about not having readmissions because the hospitals basically can end up eating the cost for
Hmm.
those kinds of things. So
Hmm.
that's a very important part, not just from the monetary standpoint,
Hmm.
but from ultimately the care. We want to
Right.
keep people at home,
Yeah.
and that's what we do. What we do.
Right.
um, so, could you go into a little bit wider change and say what is the difference between non-medical and
Hmm.
medical, and kind
Hmm.
of make the distinction because you are non-medical, correct?
Correct. Yeah. So Difference between non-medical and medical is the non-medical people are not dealing with the daily medical needs that somebody might need, such as insulin type of shots,
Okay, shots.
medications with, we can't administer medications. I guess that's kind of what the limit there is. We don't have the opportunity or ability to be able to address wound changes or management there. We can do like I said, going back to the medicine, we could do reminders, but
Sure.
we can't do the administration.
And you can observe them taking
Correct.
their own medicine, but you can't get the medicine out of the bottle and give that to the person.
Correct.
All right.
Mm-hmm.
Now, if the family or a doctor or something makes up the the weekly, morning to night kind of stuff, you guys are able to get that out and point out the right medication to take and document that they take it.
Correct.
Okay.
Yeah,
that's
we
fair.
could do physical assist in that
Sure.
degree. Mm-hmm.
All right. But things like physical therapy or occupational therapy are not something that you guys.
Correct. Now we can kind of extend off of that with exercise assistance,
Sure.
but that actual PTOT is something
Excellent.
that we don't provide.
Well, how does this work with insurance? Everybody wants to know, how do I pay for this? What does insurance cover? What doesn't it cover? How does that work?
So there's a few different things that you can go through. It's not provided through your standard medical insurance like MedMutual or Aetna or any of those. But what we do work towards utilizing to shrink that private pay. It is private pay.
Sure.
Is long-term care insurance management, life insurance. There's life enhancement riders. And then VA aid and attendance. So we try to help them to navigate through those course of options to help pay for it.
Sure.
Now there is, if they are feeling this situation is imminent and they want to do this, we can provide them with somebody that can help out with home equity transitions and or life insurance conversions. So
Sure.
instead of life enhancement riders, there's also life insurance conversions.
So let's take a step back for a second. If you could give anyone some advice while we're still whole and healthy about planning for the future, what things do you see in your business that would be a good idea to put in place early on and have available in such a need as this? What types of products?
Life insurance or life. Well, if you're able to get a life enhancement rider on your life insurance policy, that helps out tremendously. But long-term care insurance, I know that they've kind of gone away from it, and it's a little bit more expensive now. But what I've found is that it allows for a lot of care to be managed with that concern of what's happening to my assets,
Right.
to be diminished. So, meaning that we could come in and we could provide X amount of care per day. They can still have their investment portfolio that's allowing them to have this, if they choose, a legacy for their loved one.
Sure.
Or provide the extra augmentation for rent, food, things of that.
Sure.
Yeah.
Now, what about an HSA or an FSA? Are those funds available or allowable to this type of care?
So they're not yet, but I foresee some change there. The cost of living at home and getting care or even going into a assisted living facility is growing. My dad, he spent it was around $6,000 a month, out of his own pocket, and then if you add that into the equation of 10 years, you can see where that goes. And
it goes quickly.
Yeah, and so it's important and that's what we do a really good job with, even with the long-term care insurance policies, just setting up a budget. Okay, like what are we going to look at it in the first year versus second year versus third year? Where do you want to be? And kind of make a plan, because it's very important to have a plan for anybody in their course of aging. Right. Yeah.
So one of the things that I've run into in my business, and I was just curious to see if you agree, is that people tend to put off things until it becomes sort of a crisis mode, and someone's fallen multiple times, or things are just really getting out of hand. What are what should be the triggers and the things that we should look for to say, this is a time where maybe we need to get somebody involved in the home, and start talking about at least some part-time help or something along those lines?
So I think that's a good question. We get so many calls of like, how fast can you get here?
Exactly. We need it yesterday.
We needed it yesterday. So I think that some of the signs that you can look for is they're changing in type of everyday activity. If they're showering, seems to be becoming less and less. If the person is forgetting to take their meds, if you're checking on them, and it seems like they're supposed to be taking their 9 a.m., but then it's 2 p.m. and they still haven't taken it, and they keep saying they'll get into it. I think I guess evaluating them cognitively, kind of anecdotally on what they're doing, and then making the decision before it gets too much, and this way you can kind of include them in the beginning of like allowing them to make that decision of, hey, this is our concern. We'd like for you to have this extra assistance, or a personal assistant is sometimes how you can phrase it. And they seem to be more open to that, especially with the warmer weather. If they want to go for a drive, they want to go get ice cream, they want to go down to the park, this gives them an opportunity, and then building that relationship can extend from there.
So do your services include like taking people for, say, doctor's appointments or trips to the grocery store or things like that? You guys can do that?
Yeah.
That's awesome.
So we can, we had a client that liked to go down to Promenade Park and just go for a walk, and we'd take her to there. And we can go shopping to Walmart and then put everything back if we need to, and take them to get ice cream or
it does happen that way sometimes, doesn't it?
Yeah.
And I think to add on to that, I think another key thing to look for is safety. And safety could be as simple as they're not paying attention to what's in the refrigerator. I had an episode where the grapes were fuzzy and they were rotten, and the individual did not want me to throw those away. And I'm like, look, it's growing fur. Oh, I guess that is. I guess you can throw those away. So when you're having things like that, and there's been a change in behavior, and there's been a change in safety, they're falling. When they get up to go to the bathroom at night, those are warning signs that we need to step up the level of care. Now, you mentioned a couple of things. Do you guys also provide warning devices like the safety alerts and those kind of things?
We do, yeah. So there's a couple different monitoring systems. There's one where it's either a pendant or a bracelet, and it gets to know their kinesthetics. So if they're walking, then all of a sudden they fall, that it knows and it alerts the local EMS. And then the other one is more of a two-way radio with the same type of system that allows them, if they pick it up wherever they are, they can say, hey, I'm lost, and it'll hone in on them and provide the information to the local EMS.
That's awesome.
Yeah.
That's awesome.
So to kind of help them to feel more comfortable there. And then we have a 90-day medicine dispenser. So you can load it up to 90 days, and then it'll send an alert, and then it'll notify. You can set it up on notification to a family member.
That's awesome.
Yeah, if they haven't taken it.
Okay.
Yeah.
So tell me a little bit about Amada.
Yeah.
Is that something that is just local, or is that more national?
It's national. So it started in 2007 by a guy named Taffa Jefferson and Chad Father. Well, I guess a couple guys, Chad Father and Ham. And they were old football players that lived or played together. And then Taffa went off into the NFL and then played for the Bears. Before this 2007, played for the Bears, Chicago Bears offensive tackle, double shoulder surgery, sent home. and just kind of, his career after a year and a half was shot, and didn't know what he wanted to do. Kind of asked his mom, and his mom told him to follow his heart, and he became a CNA, and just kind of it took off from there. And then in 2007, Chad Fotheringham, kind of we got involved with TAFA, and they developed the name Amada, which means to love or be loved. Chad came up with the name from his missionary work down in South America, and it's taken off from there. So there's 144 of them. They're different than the other home care companies in the fact that they're based in large geographical areas. So there's one in Northwest Ohio, but that covers essentially Findlay to Toledo, a little bit over to the border into Michigan,
Sure.
and then from Indiana border to Sandusky. And then there's one in Columbus, one in Cincinnati, one in did I say Cleveland?
No.
Okay,
Yeah.
in Cleveland. So now, and those take care of all those regions. So when you answer the phone, we're not asking what area code you live in. We're just taking the call and providing the care.
That's great. So you have then workers that cover those areas for you.
Mm-hmm. Yeah,
that's great.
Yeah.
So how long have you been doing this? How long have you been in business?
So we opened our doors in December of 2020. Yeah, it was. We got the phone, or we got notified. I got notified by Amada through LinkedIn, and in January 2020. Went back and forth. Should I do this? Should I not do it? Should I do it? And then all signs kind of led to do it. Signed, opened in December of 2020, and then tried to implement all the strategy that they told, and it didn't really. It wasn't as easy as what they made it to be. So
it never is opening your own business,
right?
Even with all the extra help, and I. I get to see you out and about, and you are absolutely everywhere.
Yeah.
I know that not only are you busy, but you have a very dedicated staff that mans the phones and goes out and does the visits. I know Ryan. We've been out several times together on mutual patients. Is there something that makes you different as Amada versus some of the other companies that are out there?
Well, I mean, I think right now our focus, on the reduced re-emissions is something that's different from us. And on top of that, I tend to be favorable towards our own more than anything else, and say our caregivers are well trained and compassionate and caring. But yeah, aside from our focus on the re-emissions, I think there's a lot of good companies out there, and there's they have a lot of differences and variabilities, and we work together in tangent sometimes, and it's I can say that there's a lot of good ones, and but we're better. So
oh, I like your attitude.
Yeah.
What else would you like to tell people about who you are and what you do?
Yeah, so I think just for you to know that I'm a local person in the community, and I'm vested, and it's my true goal to provide the care that I think that I would want my mom or my dad to receive.
Sure.
And that's what I strive for daily, and doing a better job and great job of communication with the caregivers, the clients, and the client's family allow for us to be able to manage the wishes of the client and their family for the betterness of the aging in process, and allowing the client to have their dignity throughout this, and
absolutely
remain safe and independent at home. So,
well, and I will just bring up something that I've personally observed. I was seeing a particular patient, and I thought, boy, I'm noticing the warning signs here. This person's falling. They had someone in the home that was trying to help, but that individual wasn't necessarily trained, and was having trouble when she would fall to be able to, pick her up. And so I suggested this to the family. And the family was a little reticent, I think, at first, because they're trying to keep mom comfortable and at home, and mom really didn't want this at the time. But that very night, she fell. and I got a phone call from the family the very next day, and they said, "Hey, um, we think you're right. We need some help." And you guys were able to have Ryan come out, and you had someone start care that evening.
Yeah.
Which I just thought that ability to flex and to get someone in the home that quickly was absolutely phenomenal.
Yeah, and you brought up a good point. I mean, our strength right now is our quick response and our ability to be able to quick response. And to put somebody into a 24/7 care position within 24 to 48 hours on any call, I think is done really well for us. Especially with our going back, now that you got my mind working here, we have a 48-hour get home safe package. So if somebody does have surgery or does have a need and is going in for outpatient or needs picked up from the hospital, brought home, we can swing by the pharmacy, get their meds, go into the refrigerator, check the refrigerator for what kind of foods they have. If they have CHF or stroke or diabetes, we'll put a meal plan together for them and make sure that they have the foods that they need, and then stay with them as they're mending off of the meds and their procedure or whatever element there is there, and then check off with the family and say, hey, here's where they're at. This is what's going on. We recommend maybe 2 or 4 hours a day, for the next remainder of the week. But that's something that we can do, and we do it effectively. I mean,
yeah, that's awesome.
Prime example is a lady. Well, we've had a couple of them. One shoulder or elbow plating, and the other one was she had an eye procedure. But we went in with her to the doctor, got the doctor notes, listened, maintain that, came home, put that in the application, and then provided food for her and stayed with her for those 48 hours. So.
Yeah, and that's so important, especially after eye surgery. There's medications that they have to take. Now, granted, you can't give them to her, but for someone who's having trouble seeing after that, so here are the meds that you're supposed to take. It says you're supposed to take this every so many hours, and make sure that that's happening. That is an amazing service.
Yeah.
Ultimately affects the patient care
right.
and their ability to get well. So that's a wonderful service.
Mm-hmm.
I think the other thing that I've noticed is that because of your networking and because of the friends that you have, you certainly are more than just Amada.
Mm-hmm.
You have relationships in the community with other professionals. So that if you recognize that something's happening, you guys have the ability to make a phone call and to have suggestions ready for the family, which I think is also incredibly important.
Yeah, absolutely. Thanks for bringing that up. That's another thing that we're trying to provide as kind of a resource team with concierge, urgent care physicians, like yourself.
Sure.
Home health, home repair. DME, just kind of, because when I went into this and when I went to see my dad go through this, I really didn't know all the resources that are available. So that's what I'm really trying to do is make sure that, there's elder law attorneys, there's financial advisors, there's real estate brokers, there's people that are on the side that can lead everybody through this process, because it can be overwhelming for a person, it can be overwhelming for a family, and as my stepmom and myself that were managing my dad, and you don't know what you don't know until something happens, and then you're like,
I have so been there. I wish so much that I knew then what I know now, and know the people that I know now.
Yeah.
But thankfully, we were able to get hooked up with some good friends of ours, and to have some care in the home. And I've learned so much through those experiences, and I've really appreciated the chance to get to know you and what you do as well.
Yeah, likewise. Great.
Well, I think that about wraps things up, unless you've got anything else you want to say.
No.
How do people get a hold of you?
Oh, that's easy. You can either go to www.amadatoledo.com or call in 419-574-9104. Always willing to talk about anything. Even if you're having some type of concern about your family or loved one or yourself, those services that I talked about with the long-term care insurance, VA and attendance, those things, we'll point you in the right direction to be able to navigate that free of charge.
That's excellent. So,
yeah.
folks, it's a good resource, even if you're starting to think about it, or maybe you're not quite there yet. These are good conversations to have, and I encourage you to do it. And look forward to talking more with you about this in the future.
Very good. Thank you, Dr. Bills.
Thank you, sir.
Appreciate it.